Good morning, everyone. I'm Asma Day. I'm one of the impact managers on the BARHII and Rise Together team. And I'll be leading us through our meeting today. I'm very excited to have you all. A few logistical things. Please remain muted if you're not speaking or asking a question. And we'll also have this conversation recorded today. So if anyone has any concerns with that, can you please let me know now? And we can see how we can accommodate that. Otherwise, thumbs up or great. Awesome. Okay. I will share my screen and please let me know if you can't see what I'm sharing. Give me 1 second. Okay, welcome everyone. We'll be going through a really important topic for this month's meeting. We'll be discussing strategies around embedding equity officers into emergency operation centers and emergency response in the Bay Area. We're very excited to go through this topic. It's a very important pillar of our COVID-19 recovery work, and I'll go through that in a little bit, and also for preparedness beyond. So thank you for joining us today. So some more logistics. If you look at the bottom of your Zoom screen to the right, you'll see a reactions button. From there, you can pick a thumbs up or a clap and feel free to react to those during the time that the speakers are presenting. Or if I ask a question and say, is this okay? Feel free to indicate that with a thumbs up or clap. Again, please remain muted unless you're asking a question or presenting. And would love to see your faces. If you have cameras and are able to turn them on, please do. Lastly, you can see your participants also on the bottom panel of your Zoom screen. You'll see a little button for participants and also a chat function where you can type in questions into the chat. And so let's use the chat for a second here. I'd love to see who's all on the call. So if you'd like to just click on the chat, enter your name, organization, and maybe one thing that you're excited about today. Okay, a little bit about who we are for those who are joining for the first time. So BARHII is the coalition of the 9 public health county health departments in the Bay Area. We were joined by Rise Together, that is our community network of organizations. And together we focus on health equity issues in the Bay Area, as well as economic opportunity and racial justice. So a little bit about what we do and how you can get involved with our work. So we offer 3 main buckets of work and support for your organizations. The first is white papers or concept papers that really ground the framing of health equity in whatever statewide or countywide issue that you are working on. And we've done a myriad of these throughout the years, and especially now with COVID-19, it's really important to frame the health equity lens on why certain policies need to be passed, like a holistic paid family leave, for instance, or paid sick leave. Secondly, we offer training. So we do this through multiple venues. We have trainings that we do in regards to workplace biases, for instance. We used to offer on-site trainings, and now those are offered virtually. We have a series of cohorts that you all can get involved in as well. And these are leaders from our region that are interested in one topic. For instance, we have the data committee, we have the policy committee, we have a couple cohorts, like the leading change cohort, for example. And so if you're interested in any of these opportunities, feel free to email me. My information will be presented at the end of today's discussion. And lastly, we offer technical assistance. So that's anything from webinars similar to what we're doing today, to speaking engagements, to holding workshops, anything that really drives theory and conception into implementation, because we know that just as it is important to pass policies on both the local and state government levels, it's also important for us to be able to implement them and enforce them after passing them. Okay, for today, I'm really excited for this discussion. Some of our objectives today are to identify some structural solutions to address COVID-19 racial disparities and secondly, to share local and national success stories of embedding equity officers in emergency operation centers and or emergency response in general. And third, we hope to guide the group at the end of the discussion today through an implementation discussion to address the unique needs in each jurisdiction for embedding equity officers into an equity strategy for the region. And this both involves folks from the government or local health department side, but also involves community partners. We know it's really important to have the two sides collaborating on efforts like this, and we'll go a little bit into that during our discussion today. And so I'll go over a little bit of background of how we landed on why this is important for today, and then we'll transition into two really exciting speakers that we have lined up today that I'll introduce shortly. We're very fortunate to have them. We have Alegria de la Cruz from Sonoma County, who's going to be representing her county and her work that she's doing as an interim equity officer. And later we'll have Shakirah Simley from San Francisco join us at about 11 today. After both speakers present, we'll break out into about 4 groups today to go through a guided facilitated discussion about how can you drive embedding equity into an implementation strategy in your region, whether you are a community partner or a government official or staff member. And then we'll do some charebacks and closing for the day. Any questions before we dive into some background? Great, hearing none. For those who just joined, feel free to enter your name, organization, and maybe one thing that you're excited about today's discussion in the chat. Okay, so a little bit of grounding just in this work. We first began our COVID-19 response back in March when the outbreak had gotten to pretty terrible standards and conditions. And so from that, we convened a large group of our partners and members, about 130 people, on a call back in March to really identify what the priority areas for our region are in terms of how do we respond to this effectively and how do we respond to communities that have been hit the hardest. Since then, we've transitioned that policy platform into a more fine-tuned recovery platform where we have been focusing on longer term solutions and what does it mean to move from response to recovery so that we can ensure that our communities that need the most assistance in recovery are prioritized. And so that recovery platform entails 4 planks that we've distilled, of which plank 4 is to radically reimagine the status quo to protect people of color's health. If you joined us during our June membership meeting, you saw that we started to address this plank when we talked about movements to defund the police and what it means for anti-Black racism in the Bay Area. And so this is another piece of that work, and it's really the implementation arm and the structural arm of this work. And so I will go through a little bit about how this came to be and what we hope this work can lend us. So between April and May, when we started looking at what inequities in the region have been rising up from the COVID-19 response, I'm sure you all have heard about the troubling demographic disparities and data that have been coming up about who has been getting infected and killed the most. And initially, we had a very much a data focus because that seemed to be where the gaps were in the region. It was really hard to get departments to not only effectively, but in a timely manner, report back on demographics of all of those who have been tested positive, who have been hospitalized, and who have also been dying. Since then, we have been noting, obviously, all the disparities have been coming up everywhere else. And it's no surprise to us, but we've been seeing it in worker law protections, the essential workers, of which a huge portion makes up people from Black and Brown communities, undocumented families not having persistent and efficient cash aid from both the state and the federal level, in addition to a myriad of other gaps that we've been seeing in the region. And so we've been really trying to identify where those areas are that BARHII and RISE together are best suited to support. And so that's kind of the initial phase of how we came to where we are today with this discussion. As we were doing this work, we started asking ourselves, how can we structurally and strategically make sure that equity response is embedded into emergency response, that they are one and the same, that the equity doesn't have to be a carved out and on the side job for somebody who's not involved in emergency response. And that's where we partnered with our Southern California partners, the Public Health Alliance, to look at what jurisdictions in California have been thinking about embedding equity officers directly into their emergency response structures or their emergency operations centers. And we've been finding similar things in both of our regions, that counties and jurisdictions that have been able to embed equity officers into their emergency response were best equipped to quickly and effectively respond to communities that need the most assistance, to set up testing where testing is needed in neighborhoods, to respond to cash aid support that is needed, to respond to food security concerns that are needed. And so we really identified this need to have a regional voice and a national voice, or a statewide voice, to push both of our regions to really drive home this implementation strategy, that yes, we need an equity officer or someone similar embedded into emergency response in order for the response to be effective. And now with the closures that have been happening, we almost have a second chance at doing this. And so it's really critical that we're focusing on this topic in this moment. And our goal is to have every one of our counties effectively and successfully embed equity officers into their EOC, hopefully by the fall of this year. So that's the big dream. And so a little bit about this brief that we're coming up with and co-developing with the Alliance. We'll be announcing it in the next week or two. And it's essentially a depiction or a survey of 4 California jurisdictions and 2 national jurisdictions that we have interviewed to identify their best practices who have been able to successfully embed equity officers into their emergency response. And so we've distilled best practices from those. There's 5 key best practices that we've landed on. We've run them by equity officers to say, yes, this sounds right. This is what I would advise counties who are considering this to look into. And we've also took a snapshot of those counties and what they've done as case studies within that brief. And so you will be able to see that. And so once that is launched, we will also simultaneously be announcing a larger webinar, a national webinar, where we're very excited to have someone from Seattle King County that has been a leader in this work nationally present with us. We'll also have 2 California jurisdictions with us presenting, so keep an eye out on that. And that's where we'll really go much more in depth into the nitty-gritty of the strategy, the implementation, the enforcement, and the evaluation of this work. Any questions on any of this before I introduce our first speaker? Okay, great. Hearing none. So I'm very happy to announce that we have with us Alegria de Cruz. Thank you for being with us today on such short notice. Alegria is the Chief Deputy County Counsel for Sonoma County and Interim Equity Officer as of just this Tuesday. So it's very new, congratulations. And we are very excited to hear from you about your new appointment, about your work that you're going to be doing with the emergency response, and what facilitated kind of Sonoma County pushing for an equity officer and landing one, and kind of how you've been working with community partners on your work. So please take it away.
Thank you. Thank you so much, Asma and BARHII, for conversation. And for inviting me in, even though I don't quite have my sea legs yet. This has been a very amazing couple of days in Sonoma County. And I just want to say big shout outs to Anya and Marin and folks who have been doing this work for time and great time and kind of getting us ready and up to speed to step into the world that you guys have created. So I'm really excited about the opportunity that the county has undertaken here and really stepped into a place of responsibility, of creativity, and of the unique place that only kind of crazy disasters allow you to make such drastic and dramatic and critical institutional change. So I think Asma, one of the first questions you asked was, what were the conditions that supported this position and this important step? And I would say that it's unfortunate that what conditions created this moment was was the county's experience, recent history of experiencing 1, 2, 3, and now 4 federal disasters. So between the complex fires, the Kincaid fire, our kind of 100-year floods in 2018, Sonoma County's EOC has been activated pretty much nonstop since October 2017. And in thinking about that, I thought about the ways in which I came into the EOC on that really fateful Monday morning of October 8th in Sonoma County in 2017. I was a lawyer at the county counsel's office. I was, at the time a middle manager, same position actually that I have now as a chief deputy. And I was one of the only folks in my office who could get through to make it into the EOC. And I wasn't an EOC person, right? I mean, I wasn't somebody who was on our emergency committee and trained in this way. So I actually didn't even know where the EOC was when I first drove into the EOC on that Monday morning. And I just want to kind of reflect on how amazing and powerful the EOC space is for those of us who've worked in kind of different places within institutions. It can be a bureaucratic, complex nightmare to try to figure out how to get things done. And walking into the EOC and really understanding kind of the power of the command and control structure, the clear lanes, the clear accountability, the clear roles that people have in there really struck me. And the other thing that struck me that Monday morning was that I did not hear Spanish going out at all in our EOC. I'm bilingual and bicultural. I come up from, the farm worker movement, representing farm career, really got trained to understand the ways to center our clients and vulnerable communities in the way that we do our work at California Rural Legal Assistance and the Center on Race, Poverty, and the Environment. And so I feel like that training really paved the path for me to make sure that I always was looking at the way in which I was doing county work from the perspective of, what would my clients in my past world sue us for? That's what I did before I came to work for counties, is that we sued counties. And so I think that perspective and really centering, the folks who most need to have their rights enforced and seen in some of those situations really allowed for that focus to be central in the way that I see my responsibility as a public servant in the County of Sonoma. So on that Monday morning when I really wasn't hearing Spanish, I went to the league PIO and said, what are you guys doing about translation of this information? How are we going to make sure that the many thousands of folks in our community who are monolingual Spanish speakers, majority of our largest language population, have access to this information? This is life or death. So we moved very quickly. I think at that time I was the only bilingual person that I had seen in the EOC, and so all the emergency calls got forwarded to my cell phone, and our EOC moved very quickly and very nimbly to make sure that we were kind of rolling in language capacity into our EOC in those early morning hours. So that's kind of how I started at the EOC, was in this really kind of crazy disaster. And one of the things, as we were reflecting, Chris Godley and I, who's the head of our Department of Emergency Management and the head of our EOC, was the way in which that emergency setting, that critical kind of like all hands on deck, everything needs to happen very quickly, very efficiently, very nimbly, very flexibly. What that does, that setting, is that it really accelerates the creation of a different culture about how to work together. And I realized that had it not been for these experiences and every single successive disaster that Sonoma County has had of my being able to serve in the EOC and have developed relationships, and really deep relationships with people who I otherwise wouldn't come into contact with at all in the county, in this time of incredible need, and really meaningful work at the EOC. I don't think that it would have been as easy for me to have taken or being seen as a leader and had a leadership position in the county. And so there's something about the EOC context that really accelerates culture change, that it really accelerates the conditions necessary to, a different perspective that's critically needed. And that, when you say it, there's immediate reaction, there's immediate resource. My experience in the EOC has, when you raise something, the answer is always like, yes, and let's figure out how to get it done. And so there's something that's really, I think, powerful and meaningful about that time. That's also this time, right? And so I think our experience of really honing some of these skills, building those deep and intentional relationships, and focusing on, communities who really need us to see them in times of great need, set the foundation, sadly, right? We're really good at this now. We have been able to see the huge cracks. We have experienced ourselves the ways that inequities deepen and broaden after federal disasters. We see and we are studying the ways in which increased numbers of federal dollars flowing into our community are actually increasing our inequities. When you have people who literally can't access the resources and the benefits that are designed to help them recover because of their documentation status or because of the bureaucratic nature of seeking those resources, like it's really obvious now. We all see that in our community. And I think the question that we're really trying to answer is, so now what? Do with, CARES Act. Are we going to program design for what recovery looks like to ensure our resiliency and our long-term kind of shared success? And so there's just, I think, because we've been through this so often together, this is a moment where we were able to step right into this opportunity and say, yeah, we got to do this in a different way. We have to have, this person in this position. And I'm humbled and I'm honored that it's me, but it's really, as a result of many, many hours of lots of folks working together and hearing each other in a really special way.
That is really great. Thank you so much for sharing that. And we do have some time for Q&A and discussion before our second speaker is able to join. And so I'd love to open it up to the group for questions for Alegria. And there's no question that's simple enough. I know that not everyone's familiar with even what an EOC is and how it differs from what a county health department does and what those relationships are. And so maybe Alegria, if you can give a couple thoughts on that for the group, that would be really great.
Sure. So the EOC stands for Emergency Operations Center. I was very much in the situation that those of you who didn't know what an EOC was in those first moments in the EOC. So it is essentially the structure that pops up during a disaster in a county's institution, and it's a multi-departmental, very deeply integrated kind of approach where you have clear chiefs in kind of logistics and operations and planning and kind of law enforcement. So everybody's got it's very structured. There are chiefs who sit in each of those pillars and who meet together throughout the day. You kind of feel like it's the process in which the county's brain kind of gets centralized in one place. You can imagine how difficult that is during a pandemic when we're not actually allowed to exist in physical space together, how much we've had to shift in that. Because there is something that is incredibly powerful about being in this tight space. For us, we're like, it's not some cool underground bunker that we're in. We're in like a room, a couple of rooms that sit next to, other county buildings. Like we're kind of a nondescript little building in our county structure. But that's where, the county's shared brain really pops up during disasters. And like I said, it's very special, accelerated, powerful space.
Excellent, thank you. Any questions for folks, anything that you're curious about? Clara, you raise your hand.
I think you're muted, Laura. There you go.
Thank you so much. Hello, Ms. De La Cruz. Congratulations on your appointment. I'm curious, since your title is Interim Equity Officer, what is the intended process to make that to establish a permanent position, and where do you see that role in your organization moving forward post-pandemic? And also just want to get a little bit more information about your specific role in the EOC, since it's largely a health-related public health crisis. How much, being a deputy county council, how much of a role do you get to play in some of the the critical decisions that are being made by the health-related staff?
Mm-hmm. Those are great questions. So let's see. I think I'll start with. We started out by popping up our EOC, and then we've shifted a lot of that work into our Department Operations Center, so into our DOC. So those are the two kind of main places that a lot of emergency operations happen. So in in our county council play a really critical role in the EOC. We really become kind of council plus. So it's not only legal, but it's also situational, strategic. We feel really lucky that our clients consider us essentially part of their executive team in lots of situations, and that becomes especially clear in the EOC. So in my day job, when I was a chief deputy, my clients were the Community Development Commission, who is the county's kind of housing and housing authority agency, so housing development and housing authority. I also spend a significant amount of my time looking at coordination of we at one time had a pro bono immigration program. We were the first public law agency in the country to pop up representation of immigrant children in their SIJS and asylum cases beginning in 2014. That has since shifted to really become a public-private partnership that supports something called the Sonoma County Secure Families Collaborative. So other ways in which we're pulling together and essentially encouraging collaboration between what could otherwise be a patchwork network of folks that we rely on to take care of our most vulnerable. So, a lot of my work is already kind of connected to and centered around the service of marginalized populations and the recognition of that marginalization and the need to shift the way in which we are delivering services to this group of people. And so, for me, the connection between the work that I do in my day job as a lawyer and, and thinking about things from an equity lens it wasn't that kind of disconnected. So, and I feel really lucky that, we have a lot of really beautiful people in Sonoma County who, before equity was a buzzword, we're really essentially trying to figure out do things differently. How do we need to do things better? So I think that maybe that gets to your question about, how lawyers in particular play a role in the EOC. And now, since we moved into kind of the DOC really leading, the Department Operations Center, so essentially the health department has, been the emergency response arm of the county with lots of support from the EOC, but it's shifted into the department level. And so when in Sonoma County, when our numbers, when our racialized Latinx spike became clear, we had at our height, almost 80% of our COVID cases were Latinx and indigenous language speaking people. 98% of our 0 through 17 cases, our kids who were sick were brown or are brown. And so that really lit a fire under us to take quick action and to figure out, one, to recognize that this isn't surprising. This is just telling us what we know about the ways in which our existing structures have failed, have continued to perpetuate inequity, because we have to really center the way that we're looking at this from a different perspective. So I think the county, what was really important and what I saw be really meaningful was the county immediately said, yeah, we own this. We get this. This isn't surprising to us. We've studied this. Our communities have told us this for a long time. So now what are we going to do? And so what we did in Sonoma County was to pop up a Latinx work group, essentially an advisory group of folks who every day are in the community of the people that we were failing to reach. And we said, you tell us what needs to get done right now. We're going to elevate those voices and we're going to get it done. And so, and the work group, I think also really importantly, I see Gavi Orantes from NBOP on this call. I just want to do a huge shout out to Gavi and to many of our task force members, our work group members. These are folks who, again, because of structural inequities, aren't necessarily kind of leaders in their organizations, but who have long been leaders in their fields, and who are really the ones who are connected to what's happening on the ground, what's happening to our people. It's people who come from these same communities that we're trying to serve. Essentially, you know, all of us in this work group are one step removed from the people that we're serving. So many of us grew up in farm worker family households, in households of low wage, essential workers on the front line. And so we, you know, every night that we go home, we see what it is that is challenging that our institutions are failing to do for us. And so those voices really needed to be elevated into our program design. And our department director, I think, was very intentional and has been incredibly protective of the authority that she has given this group to say, I need you to honestly tell me what you have the capacity to do. And I want you to tell me exactly how that's going to happen. And then we're going to say yes to that. So please give us your best. And so what we've done is we've reflected those recommendations and those voices and elevated them into, you know, the way the county operationalizes our efforts is we put out an RFP and, you know, we have said to our community, here are the recommendations that this important task force has given us and about what it is that our communities need right now. What we're asking you to do is go have a strategic conversation with the leadership in your organizations to figure out how to center these voices in your own institutions. And so I think what is really powerful about this effort is the way in which when the county centers equity, what we require throughout our entire community is for our organizations to also center equity. And when you come into some of these places of, you know, again, these institutions that are asking themselves, what can we do? Why the spike? And you look around those rooms, those Zoom rooms are not a diverse group of people. Those are not the folks who are connected to the communities. Those are not the folks who are one step removed from the people that we're serving. And so similarly, what we're asking our institutions on the outside, our partners, is to join us in this moment of elevating a different set of voices. Join us in this moment of centering and having a very different conversation with yourselves about, you know, who needs to be leading in this moment? How are we going to dedicate the resources and the attention that lines up with the need in the community? So in many ways, how are we going to make sure that if 80% of our cases are brown and our kids population, how are 80% of the resources in your institutions and your own organizations, and how are you really, you know, showing us the investments that you're making in the way in which you're going to deliver services that is focused in the same way that the data is showing us that's where the need is, right? So we're really hoping to get a group of really exciting RFPs back from our institutions who I think have been really joining us in this conversation about, like, okay, we got to know that we're going to own this moment, and that these numbers are not, you know, they might shock you, but they shouldn't surprise you. And what they tell you is that there's something different that we need to do. How are we going to really elevate that conversation and do something differently in this moment? How are we going to take advantage of this opportunity?
Thank you for that, but I was also interested in hearing about the specific fact that your title is now interim equity officer, and what is the plan for there being a permanent equity officer? Where would that position be in the organization? If you could elaborate on that, that'd be great.
So I think our board took a very kind of nimble and flexible and immediate approach by recognizing the need to really have some one person center some of our efforts that were otherwise disconnected from each other throughout the county, to really hold some space, and to really, again, elevate those issues of equity that were coming in many different places but needed a home, and how important that was to do right now. So the goal is also the recognition that this is a position that needs to be institutionalized at a high level. And so the proposal that was recommended by staff, you know, and the staff who've been working on this for quite some time are a really powerful cohort of folks who are called SoCo Real, who essentially are the 2 years of the GARE part of the GARE cohort, unfortunately. But it's a lot of these folks who have for the last 2 years been really deeply engaged on questions of equity within county government. And working with our HR, our board of supervisors actually in January adopted a strategic pillar as part of their strategic planning effort that was about equity and social justice. So our board really took the first step in kind of, opening the door for us to be able to really engage with this as an opportunity. And with that, we rolled into, okay, again, this moment, COVID hits, how do we accelerate the process of embedding equity in this response and embedding equity in our county government? So the board has approved a longer term strategy that includes the appointment of a permanent equity officer who sits at a department head level, who reports directly to the 5 board of supervisors, the 5 supervisors on the board. And we will be doing a nationwide search. I am psyched to be part of that nationwide search. I'm psyched to be part of the process of maybe being considered to be the permanent. I think that the goal here is to figure out both how we move immediately in this time of opportunity and how we make sure that, that the way that we move immediately does not harm our long-term effort to do this meaningfully. And, I think what we have seen time and again with, every time a disaster, you pop up an equity team. Every time there's a disaster, you pop up your bilingual, bicultural staff. And what we have realized is that, you can't just pop us back down when the disaster is over. And what is being recognized right now is that you're popping up this group of folks who are going to be engaged over the long term. And we're seeing, skill sets around service provision, program design, all of these abilities that we do in times of disaster really well, really nimbly as a result of the intense need. That is something that has to be taken over the long term. We have to see those skill sets as being critical to, responsible public service, not just when we're on fire, not just when we're underwater. And so that's what our board has done. And I'm really excited about that very high level commitment to this position being a position of power and authority, of elevating visibility of these important issues in our community.
Thank you so much. Excellent response.
Thank you, Alegria. I think we might have time for 2 or 3 more questions, and I'll try to consolidate because some are related. One is around how does the Sonoma EOC engage with community-based organizations that are serving the communities of concern? I know you started to address this a little bit. And with that, I'll just attach another question, which is curious about the percentage of Latinx population in the county. I'm not sure if you have that number at your fingertips, but.
I think we're somewhere between 27 and 32%, depending on kind of who's gathering the information. And Stephanie, you might have that data really at your fingertips. Stephanie Manieri with Latino Service Providers is here with us too. So all of these awesome folks from our community that we work with every day, I'm psyched to see we have a really beautiful tight community as a result of what we've been through together. So let's see, how does the EOC engage with CBO? So that's a great question. We had a VOAD, which is volunteers organized hi, Gabi, maybe you're gonna have to help me with this. The VOAD is the kind of the volunteer group. We've shifted that and recognizing that it's kind of community organizations activated in disaster. That's what it is, volunteer organizations, community organizations. Saying, this is not a volunteer effort. We're gonna recognize and we're gonna institutionalize our commitment to partnerships and strategic partnerships with our community. So we're gonna really elevate that. Our CBOs are part of emergency. I think, we're super lucky that we have a new co-ed director in our county, and Rocio Rodriguez, I saw her on here too. We're super lucky that the head of our co-ed is, a bilingual, bicultural leader. And so I think, we've made a really critical commitment in our county by making that kind of a choice around our leadership for our co-ed. Again, you're seeing this ongoing dedication to elevating, quote unquote, new leaders, recognizing that these folks have played leadership roles in their communities and in the ways that they've done their work for a long time. So it's really seeing that leadership for the first time. And our co-ad with the appointment of our new director, I think is really engaging in some very strategic and high-level conversations with our EOC and with our county as a whole, with our community organizations, which is, how do we make sure that, because the same institutional inequities that exist in government exist in our nonprofit industrial complex, how are we going to make sure that our co-ad is not also engaged in the recreation of institutional inequities in the service provision that they do during disasters. And so again, I think it's making sure that our opportunity to really center different voices in these conversations and in a relatively underrepresented area of leadership in our county is done in a very deliberate fashion.
Great, thank you so much. And one question related to the engagement of community. So someone from APEN is working alongside environmental justice partners to pass SB 160 to require county emergency operations planning to incorporate community engagement and cultural competence in order to reflect the diverse needs of all communities during disaster preparedness, response, and recovery. Has Sonoma County discussed this?
Yes. This is a really important opportunity. So SB 160 passed its law. The next time that you as a county update your emergency plan, you have this new responsibility to consider cultural responsiveness in your emergency response. So I think that this is a great opportunity. Please don't check a box. Please don't do an online survey with your vulnerable communities and call it done. I think we are really lucky in Sonoma that our emergency director has really kind of answered this call and not only considered kind of cultural competence, which I think for many of us were like, ooh, competency, like that might be a low bar. Like, what does cultural responsiveness look like? How can we define that and work towards that in our planning processes? And so, I think that's such an important opportunity. So for community organizations that really want to find a hook to pull your counties along, look at SB 160, get involved in the next time that the slightly wonky, slightly bureaucratic process of updating a county's emergency response plan happens. Keep your eyes on that prize. It's a really important opportunity.
Excellent, thank you. And one last quick question before we transition to our next speaker. If you can spend maybe 30 seconds sharing a list of a few key successes that you've had in advancing equity within the EOC, if at all, because I know you're relatively new, so whatever you can speak to that would be great.
Sure. I just want to give a shout out to Chris Godley, who's here on the chat and just reminded me the ways in which Sonoma County's EOC is really leading on these questions, and that we both commissioned and offered the first kind of cultural competency and emergency management courses in February. So we've got some real plans and some real action already taken around how our specific emergency response in the county is going to be supported with some of these important resources. And I just want to shout out to Chris again that I think Chris also has done as our department grows, as we continue to deal with more and more disasters every year, Chris has made some really critical hires in hiring people who are bilingual and bicultural in the emergency management department, and recognizing the ways in which emergency response, I understood from Chris, talking this morning, that community of folks has also really shifted. It used to be a place for kind of retired law enforcement, retired military, folks who may not always be as diverse. And it's really shifted into being an area that is attracting a lot of interest from people who are typically kind of more liberal arts focused in education, a younger population, and really providing a new entry into public service that is a much broader skill set that is required at this stage, given who we are in California and given the needs of our communities. So just huge shout outs to Chris as a leader in our county for really considering and acting on the recognition of the important value of a bilingual bicultural skill set in emergency management.
Great, thank you so much, and thank you everyone who you've given a shout out from Sonoma County. You all are leading some really important work in the region. We're very excited to see what you're doing. And thank you for being with us today and for sharing your incredible journey. And I know that there's going to be more to come, so we're very excited to see what's on the horizon for you all. For those who are interested in connecting with Alegria, her email address is right here on the slide. And feel free to reach out to me afterwards as well. I'm happy to connect you to Alegria as well. With that, we'll transition to our next speaker. Thank you, Alegria. We have with us today Shakirah Simley. Shakirah, you're on the line.
Yep, I'm here.
Awesome. Welcome, Shakirah. Shakirah joins us from San Francisco. She's the director of the Office of Equity, appointed by the Human Rights Commission. We're very excited to have her with us today. She has been doing a lot in her department on emergency response within the lens of equity, and has been doing some really great work. So we're excited to have you. Would you like me to stop sharing my screen so you can share anything, or?
I think you can keep, let's see, keep your screen for now. Okay. Hold on, let me pull up my my slides. In the meantime, I do want to share some resources. Let me just take a step back and I can introduce myself. So,
yes, great.
Hi everyone. My name is Shakirah Simley. I am the director for the Office of Racial Equity for the City and County of San Francisco. This is division through the San Francisco Human Rights Commission. This office was legislated last year, which makes us a little bit different than other offices of equity because we actually have a legislative mandate and put into place. I stepped into this role in late December 2019. In 2020, none of us could have imagined what 2020 could have given us between a global pandemic and a national rebellion and our righteous racial reckoning that we're facing right now. So it's been quite the ride to build this office from scratch, operationalize it, and then heed the call from the mayor's office to step into our city's emergency operations center at the start of our shelter-in-place order here in San Francisco. So I want to just take one moment and share a couple of resources in the chat that will help you better understand some of the things that we've done in my capacity as San Francisco's equity officer. So first things first, we just released a new report on our website that kind of talks about some of our activities during our deployment. This is a clarification point that the EOC is ongoing. It has shifted from being a very large 400-person command center for a disaster response, and now it's shifting to something a little bit smaller, nimble, and adaptive into something we call unified command. And the San Francisco EOC has served as our nerve center for our COVID deployment of resources, which is really important in a disaster, of staffing, so bodies, right, to get the work done, policy decisions, so how we decide who gets what testing site gets set up, what contact tracing looks like, and then also just managing the day-to-day dynamic nature of this pandemic. Okay, so it's kind of like a nerve center. And our EOC has actually been set up since January. It started out of our Department of Emergency Management, working closely with our Department of Public Health. And then when COVID really exploded across the United States, we moved from their offices into the Moscone Center in San Francisco, which is a conference center, to be able to accommodate the need. At the beginning, it's between like late February, early March, Mayor BARHII directed my boss, Director Cheryl Davis at the Human Rights Commission, to set up a community roundtable to help inform what we needed to do in regards to COVID. And that roundtable has been in place for the past, I believe, 4.5 months. And it's a coalition of, I think, over 40 different community-based organizations that are working together across every every neighborhood in the city and different racial and ethnic groups to help inform our city's response. Parallel to that effort, we saw that in order to understand what's happening day to day, and like I said, have access to those resources, policy, and people, and meet the community need, Mayor Breed, Director Davis, and our head of our emergency services asked me, our director for the Office of Racial Equity, to step in as the city's equity officer. And that was a really interesting challenge because similar to our folks in Sonoma, I am not a emergency management professional, but I, dug into my resilient and adaptive self and took on the job. What I also understood is like I couldn't do this by myself. So what I asked for was a power to deploy as many assistant equity officers from different departments who had different skill sets, who could speak different languages, who understood certain vulnerable populations to help assist me in the EOC. So I've trained up 10 different individuals from across 7 different city departments over the course of 17 weeks to help us do this work. It takes a lot of hands. San Francisco city government is like an octopus with lots of different tentacles, and we needed eyes on the street at every single level. A couple of things that have already been mentioned that I want to amplify and make sure everyone is thinking about when we're talking about COVID is that COVID is racist as all hell, right? It's a racist disease because it targets people of color, right? And we are seeing in COVID cases, transmissions, and death that it's primarily Latinx folks, Black folks, and Asian seniors. And that is not by accident. We know that the way that this disease moves is very cruel, and it follows, our inefficiencies in health infrastructure, and it also follows social determinants of health. So it's no surprise where this is going. And this is something I feel like I have been screaming from the top of my lungs. We knew where this was headed, and we were pushing our Department of Public Health to work with us to target certain areas where we felt like for our workers in our informal economy and hospitality industry, to looking at public housing and congregate living situations and SROs, to looking at our monolingual communities who may not necessarily have the in-language support that they need to understand what's going on and get the public health orders translated and understood, to making sure we are talking to our young people. I think initially COVID was really because of the vulnerable populations and its impact on seniors was, I think folks just assumed that it wouldn't impact them, but we now know we're seeing our surge and our cases are definitely within folks age 19 to 45. And we also know that certain neighborhoods based on their demographics would be hurt the most. So doing that work, which I hope everyone clicks on our progress report so you can see some of the impacts of our office, we focused on some major things. Number one, we focused on testing. It was hard to get 100% universal testing in San Francisco, even though we have very broad criteria to get tested. So it's not so hard, but we wanted to make sure that testing were where people were. So we fought to make sure that we had testing sites in key neighborhoods, including the Tenderloin, the Mission District, Bayview, Hunters Point, Sunnytail, Potrero, and the Western Addition. And those are neighborhoods that have primarily folks of color. The next thing we focused on was culturally competent contact tracing. And understand, city government, not great at like community outreach engagement and respecting the work of Native-based organizations. And there's a lot of distrust there, particularly in health systems. So we wanted to make sure that our Department of Public Health worked collaboratively with the community-based organizations who are already there on the ground supporting their community, to have contact tracers with the language and familiarity to ask questions to make sure that people were staying safe. We also worked with our logistics chief to make sure that PPE, cleaning supplies, masks, and other sort of like, preventative materials were going directly to these communities. And we worked with our Human Rights Commission roundtable to help understand where the need was. We also worked one of the things that I was really wanting to push for was a feeding and food task force. One of the issues of COVID that we're seeing, or a byproduct of COVID, is that food security is skyrocketing. When you have broad scale income and job loss, folks give up certain things or don't have access to certain things like food. So our feeding unit has been working to, make sure we're connecting with our Human Services Agency, our Department of Public Health, and our Department of Homeless Services to make sure that we're getting food delivery, meals and groceries to our different populations, and working with our food bank to set up more pop-up pantries, which are more nimble and directly within neighborhoods. Another thing that we focused on, which was really important, and I will put this in the chat, is pushing our policymakers and our health officer to expand upon the definition of what vulnerable is. And for some of you, that might be like, what does that even mean? We know that COVID impacts people over 60 and people with underlying medical conditions. Well, remember when I said COVID is racist, right? We also know that COVID disproportionately impacts other people too, and also other vulnerable communities like our unhoused population and other folks facing health disparities. So we co-authored a health advisory, which was put into effect, put into effect on June 2nd, which directs providers, clinicians, and our systems of care in the city and county of San Francisco to make sure we're prioritizing and centering this updated list of vulnerable populations as well in our system of care. And this is, sometimes in making these small policy decisions can have a huge impact, because when you expand a definition, that opens up really important things to more people, like testing, like hotel rooms, like food delivery, like follow-up care, and things like that. So I wanted to share that, and hopefully that can be used as a model for other county health systems to inform who you're serving, why you're serving them, and respecting the disparate impacts of COVID. And then the last thing that we really focused on, in addition to the efforts that I just talked about, is working very closely with San Francisco's data team. They're called Data SF, to make sure that, and I'm putting our data tracker in the chat, to make sure that we have a dashboard that's transparent, clear, and disaggregating based on different demographics. So we understand how COVID is impacting our neighborhoods, our racial and ethnic groups by gender, and also understanding different environments. So we help with the creation of like a public housing dashboard, and we're still pushing to make sure that we're having this lens on data in our recovery efforts as well. So the other half of my team, she has been working on our San Francisco's economic recovery task force for COVID. So while I've been at the EOC, my other staff members been on the recovery task force, so we've been bouncing back and forth. But we've been wanting to push and make sure we have a racial equity lens in our recovery. When we talk about our economy, we know that our economy, particularly in California, is built off of the backs of Latinx and Black essential workers, period. So if we're going to be reopening, we need to make sure that we're taking care of our people first and foremost, who bear these disproportionate disparities and don't have the choice to stop working, or may have to go to work sick because they don't have protections, the ability to socially distance, access to PPE, and a safe living situation. So those are kind of some of the highlights. The report goes into more depth about some of the things that we've done. Right now, I'm taking a little bit of a step back from the EOC. We are in the middle of our city's budget process right now, but that EOC experience was instrumental in how the Office of Racial Equity here in San Francisco is thinking about budget equity in our analysis and our recommendations to the mayor's office and to the board of supervisors. And because we had that over 3-month experience, we can say, like, actually, if we're spending our money, this is where it needs to go, because we're seeing how COVID is impacting this, impacting our city. So for example, we can advocate for more resources for food security because we know that's what's going on. So it's been a really interesting process. I hope that these resources help. It's been, and I'm also working with our unified command through EOC to have someone more permanent. So I'll be hiring a staff member who could be our permanent EOC officer, because I'm wearing lots of hats in city government, and trying to dismantle structural racism within city and county is more than a full-time job. So we're trying to make sure we are spreading the love and the capacity of my team to do this work. But it's essential, and it's been a really illuminating experience. I'm grateful to have been able to step into this role. Thank you all so much.
Awesome. Thank you so much, Shakirah, for sharing your incredible work thus far. I know you're a little strapped for time, and you have to leave us here in about 8 minutes or so. So I want to open it up to a few questions. We have one around what you're looking at in terms of protections for essential workers. You mentioned that piece briefly, but if you can go into a little bit more detail.
So as far as protections for essential workers, we have to look at that structurally. So the way that I think about it is like, yes, we can go to work with merchants organizations and community-based organizations, and we work with the Latino Task Force, which is a Latinx-led group here in San Francisco that for targeted certain neighborhoods and businesses there to give our workers, face coverings and hand sanitizer and cleaning supplies. And we also know that structurally, we need to hold employers accountable, right? Because I could do all this individual behavior. You all are public health people, right? Individual behaviors sometimes don't match up with if you're living in an oppressive system or environment that doesn't allow you to be healthy. So a couple of things, Mayor Breed, towards the beginning of the shelter in place, released a policy and funds to allow our essential workers to have access to hotel rooms if they have tested positive for COVID. She also released a policy allowing for 80 additional hours of paid sick time as a really important intervention. The uptake of that sick time is a little bit slow, so our team is pushing to work with our Office of Economic and Workforce Development in the Public Health Department to let workers know that if they get sick from COVID, they have paid sick time that's covered by the city. And then another thing is that we're in conversations about the fact that if our major large employers are not creating a safe place for folks to work, like our big grocery stores or big box stores, then what accountability should the city do in order to hold them accountable? So there's the individual work that we're doing, but there's also like the structural ways to hold these employers to the task, and also some policy interventions to provide more support for folks.
Great, thank you so much. A couple more questions here. Can you clarify the San Francisco City's EOC's relationship with the county's response, and how, if at all, the equity officer is involved in the San Francisco county-wide response?
I'm a little confused by the question because San Francisco is a city and county all in one.
So those would be the same?
They're the same entity.
Same entity.
So Mayor Breed is over both the city and county of San Francisco. And I do know that between the 6 counties of the Bay Area, there's been a lot of coordination with our Joint Information Center, with our different public health departments. I mean, they talk all the time and work together to create Bay Area-wide public health orders, whether it's universal masking or the shelter-in-place order, and making sure that there's coordination, because we know people travel, of course, across borders very easily in the Bay Area.
Great. Next question. An EOC can be a crazy place and often challenging to get the attention of those in leadership. A common solution is to design the EOC structure to clarify reporting relationships. How does your team fit into the larger EOC structure in terms of organization or positional relationships?
That's a fantastic question. When I first got to the EOC, the reporting structure was not clear. And it took me about 2 days to be like, if I'm going to be here and taking a time away from my, I have a very high position within city government, and I think that's intentional. So I push to make sure that the EOC is part of the management team. So it's not stuck underneath, different chiefs, an operational chief or whatnot. It's actually part of the management team and can help inform the EOC director directly, because there's a lot of, I'd say, really sensitive and hard things that our team often uncovered that you would need kind of some heavyweight to make sure that was pushed through. And having that access to all of our department heads was essential to help inform decision making. So if your county is thinking about setting up an equity officer, make sure that they are part of the management team itself, first and foremost.
Great, thank you. Another question is, how is San Francisco holding employers accountable? I think this relates to the essential workers piece you were talking about and protections. It's been challenging to get this here in Sonoma from policymakers and leaders.
So it's been challenging for us too. One thing, I think our Office of Economic Workforce Development has been trying to work with businesses directly, and our recovery task force to make sure that businesses have what they need, and taking a carrot stick first. So, if you are a monolingual speaking business owner, like, do you understand the type of protocols that need to be put in place? Like, do you have what you need in order to pass like health inspections? Like, what kind of, training or technical assistance do you need to make sure you can protect your employees? I think this has like been a challenge for us. I mean, one idea that I had was like, do we need to engage our city attorney to send messages to our larger private employers to do better on behalf of their employees? So I'm trying to push for the uptake of that idea, but it seems like even if you put a lot of work into individuals, and even if you're working with merchants associations, you still have very large private employers who you might even have outbreaks and things like that, and you might not even know it. So I think it's important that you continue to push that conversation within your county to do that work, particularly on the large guys.
Great. And the last very quick question is, how large is the Office of Racial Equity, like numbers of staff wise?
So we just started. Right now I have 3. I'll be hiring 2 more folks. And then we're situated within the San Francisco Human Rights Commission, which has about 35 employees. So we're starting small. It's a new initiative. It's a lot of work. Very proud. I wish I could clone myself. If anyone knows how to do that on this call, please let me know. And yeah, it's been a lot. It's been a lot. So one thing I would also say, if you are serving in the EOC or you are an equity officer, to please prioritize your self-care. It's a grind. We were working 12, 13 hours a day, 7 days a week. It's pretty relentless, but COVID is a marathon, clearly not a sprint. So we need people to be healthy and safe as well. So please take care of yourself because of the work that's required.
Great. Well, thank you so much, Shakirah, for being here. I know you have to hop off now, so really appreciate your time. You're incredibly busy. Thank you for all that you do and for sharing your expertise. And for anyone who's interested in connecting, Shakirah's email is on the slide. And we'll be sharing all the resources that she put into the chat with the packet once we're done with the call. So thank you again, Shakirah. Really appreciate you being here.
Thank you, everyone. I appreciate you all. Please stay healthy and safe.
You too, Shakirah. Thank you.
We need you in this fight.
Great. All right, transitioning to a little bit more of a hands-on experience today. You heard both of our speakers to different and also similar experiences in embedding equity into EOC or emergency response. And now we'd love to hear from the rest of the group. So just some logistics about this breakout. We'll be breaking the group out into about 4 groups, and you'll be randomly assigned. It'll happen automatically, so don't freak out. Each room will have a discussion leader, one of the BARHII staff members. And we'd love for you all to identify one person in the group who can be someone to share back the main takeaways of the discussion with a larger group once we are done. This activity will last about 20 minutes, maybe 25, so maybe spend about 5-ish minutes introducing each other, and would love to get into a bit of a deep dive discussion when you can. And then once it's time to rejoin, you'll get kind of an automatic countdown timer that will just automatically pop you back into the larger group. Any questions before we all head off into our fruitful and productive conversations? Hearing none. So if I can ask Siobhan to please go ahead and send us off into our groups. Welcome back, everyone. All right, I think we have most folks back. It seems like we never have enough time for these things. We've kept iterating. We started with 10 minutes for these things, grew to 15 to 20. So I apologize for not having enough time to go through everything, but hopefully whatever your group didn't get to in the smaller breakouts, we can share with a larger group here right now. And so if we can start with maybe Will's group. I don't know who your facilitator or shareback person was.
It was me, Nora. Hi. So we only designated somebody midstream, and then to be honest, I feel like I did a lot of talking, so I'm going to let anyone else from our group who feels like I'm not representing anything but my own thoughts chime in. But in terms of gaps, you know, we talked about how we're supporting people to successfully isolate and quarantine. So what resources do folks need once they have that direction? We talked about language and outreach and engagement and making sure that we're, you know, covering all of the languages in our communities, as well as using strategies that aren't just translating things that are meant for an English-speaking white audience. Enforcement, that was a big one. You know, how are we enforcing some of these things? So we're identifying these gaps, but how are we actually making sure that we're holding people accountable, and whose responsibility is that? Is that the health department's responsibility, or those other agencies? And we don't have an answer for that up here. I think folks on our call felt similarly. We talked about the gap around data, and you know, there was a lag time, I think, across the Bay Area in getting out disaggregated data about vulnerable communities and who is being impacted by this nationally as well. And so in the push to get those data out quickly, I'm not sure that we really lived up to our responsibility to create a narrative around those data that interpreted them for people in the way that they should be interpreted. And so in some places that narrative might have done more harm than, or the data being out without a supportive narrative might have done more harm than good, in terms of others in the community thinking, oh, well, that's not really my problem, and that's personal behavior, and all that stuff takes some responsibility. So, you know, working to improve the narrative there. And then just in terms of how BARHII can help, I think people appreciated these spaces to have these conversations immensely. You know, we talked about opportunities to, things are moving so quickly, so how do we, is there an opportunity for like an online space where equity officers or people engaging in this work can post things? Is there a way to just see what people's, you know, day-to-day tasks or 5 objectives are, to make sure that we're not missing any big gaps in our response? You know, models for the structure. Where does this best fit in an ICS structure? Who should this report to? Who reports to this person? How does this person have some leverage over the other, you know, operations chiefs and things like that? And then you know, how do you do this without an official equity officer? Who takes this job on, and what level of authority do they need to be given? What's the right level of staffing? Those are some things that we were hoping that this group and BARHII can help kind of continue to tease out. What did I miss, Will, or others in our group? Yeah.
Sounds great. Excellent.
That's great. I just want to pop in for a minute and say thank you, Nora. And we do have an online space that we've just gotten online. And so if you want to, if you're interested in joining the equity officer list to hear and see resources as they come out, that'll just get popped up onto that Slack server. Please email, you can put your email in the chat box here, or you could email Melanie Newcomb directly and we'll set you up on that.
Great. Thank you, Melissa. All right, let's jump to Darius's group for the 30-second version of the highlights of the questions that you all discussed.
I believe that was my group. Right. Okay, so great. So some things that we talked about was having a designated seat in the EOC is really important. Even if you don't have an equity officer, at least a designated seat for somebody who's involved in the community, who is part of a CBO. It's an evolution of a process, so taking it step by step, but timely, at least timely. Let's see what other things that we talked about. Having a lead equity position and closing gaps, it's important for advocacy, somebody that can hold people accountable. Also, somebody had noted that counties, they saw the counties with equity staff early on were better able to respond to data needs, which I think a lot of us saw. And then also something else that was mentioned, at least with gaps, were language translation versus interpretation, disaggregated data delay and response, who responds to it, consideration of space and sheltering, especially right now, and how there's a little bit of a lack of conversation of that. And then also a tendency to forget, especially within COVID, people who are the most vulnerable, who can be exposed, who do not have access to shelter space. And then the last thing that was mentioned with BARHII was advocacy and how, and please correct me if I'm wrong, but somebody from NAPA mentioned how they were the last ones to implement tenant protections, and BARHII called them out, and that was able to provide this advocacy space to county to get it implemented.
Great, thank you. How about Matt and Maritz's team?
Sure, we had a great conversation. We found out more information about the County of Marin's equity officer and about how the County of San Mateo is moving to create an equity officer position and to recast an existing department to include social justice issues. So some really exciting ideas there to amplify and replicate. One interesting idea we hatched during the conversation is the potential for some sort of a network of these equity officers for the Bay Area to help strategize and solve problems together. We talked about the importance of relationships within these county systems that can help open doors and help get the important work of social equity done. I thought our speaker from Marin had a particularly useful frame around that it's important to have someone with an equity perspective within the EOC who can shift the conversation from, quote, people just need to blank, and instead to understanding the systemic barriers that prevent people from being able to protect themselves, protect their health. And the importance of tapping into grassroots community groups, not necessarily the larger groups that have a 501c3 status, and the need for multimodal approaches, because one particular frame or approach will likely not be sufficient for the diversity of issues that counties are facing.
Great, thank you so much. And then for my group, if I can have Kanwarapal go first. Our conversation got cut a little short. So if you want to just quickly address kind of the gaps that you're seeing from the community side, and then I'll hand it off to Megan to give us a bit of a summary of everything else that we've discussed, maybe 30 seconds each.
Hi, everybody. From the community side, I think what I can share is it's nothing new, but I think it's sort of a highlighted and exacerbated struggle of systems are really about sort of widgets of production and productivity, and really addressing equity and justice is about addressing the harm in relations, and it's relational work. And so, you know, it's that I had mentioned this in the small group, like I'm ambivalently hopeful that maybe this will make some moves, but systems get really stuck in what are we doing versus how are we being? And so it's really how do we sort of create those spaces and calls for system leaders and stewards to have spaces to be and to really reflect on like our own selves as racialized beings. And that's some of the work we're starting to do. That systems are networks of people and communities, and white people never have to be racial beings, and they lead most of the systems and then decide who's a racialized being or not. And so I think we really have to flip the script on that. And I think white folks have a lot of work to do to sort of give up power, to be uncomfortable with being misunderstood and not knowing. And so it is that, yeah, that relational and reckoning piece that I think is really critical. So we're trying to push that as central before we sort of start figuring out the form and function of an office. How are people going to show up differently and take the risks to be righteous? So I'll stop there.
Great, thank you so much for sharing that. Megan, do you have a couple of
Sure.
thoughts?
I was taking notes here for us. I think we had two folks shared very importantly that it is not the sole responsibility of the EOC officer to manage the entire lens of the entire response. So it's important that there is an equity officer in the EOC and DOC, but maybe that their role is less, I don't know what the word is, responsible for everything, but responsible maybe more for infrastructure or for pushing people towards things or for holding people accountable. I think that was beautiful. That came from two different folks, Wilhelmina and Allegra. And then we also had that leading, the leading positions need to be communicating with those working on the, rubber meets the road place, and making sure that, all the way from contracts to communication are looked at. So I think those two things were really stood out to me. We also were mentioning that big thank you for San Francisco, great test case for us to look at and to reflect back their successes. So I think that's pretty much what I had, but I mean, this has been invaluable. I can't thank you enough, and I just really appreciate everybody.
Awesome, thank you so much. Thank you to everybody who shared, all the volunteers. I know it's never an easy ask, so I really appreciate it. And thanks for everyone for your time today, for being engaged in the conversation. This is a really exciting step in the right direction for us as BARHII. And up on the screen, you can see our contact information if you'd like to be more involved in this work. Like Melissa mentioned, please feel free to reach out to us. We are more than happy to engage with you all, regardless of whether or not you work with a community organization, grassroots organization, or government entity. So again, thanks everybody. I'll be following up with all of our resources from today, including our slides and our speaker information. I hope you all stay safe and hopefully see you next time.
Thank you, Asma.
Thanks everybody.